Good morning.
And I'm Tava Alim, and I work at Project Ujima as the program coordinator. I think we have a good program planned, and this is the first time that Project Ujima has had an opportunity to do Friends and Family Day. Every year for the last, we've been doing the Wellness Circle for about 3 years, the Tai Chi and Qigong at 10. And once a year at this time, we do Family and Friends where we have a little refreshments and so forth. And what this is about, we call it Village Talks. So we shorten down Tai Chi so that we can have a good hour afterwards to just talk about issues that are important to those of us in this circle. And as one of our good friends of Project Ujima, his name is Joseph Coleman, and he always said this quote, and we like to always quote him: all of us are smarter than any one of us. So the whole idea of getting in a circle is to share information among ourselves. And we are the voices for each other. So that's what this is. Yes, we have invited guests who are experts in their field and whatnot, but they're also in the circle. So I'd like to get us started. And all of you know the title, A Community Conversation Centering Black Voices and Their Thoughts About the COVID-19 Vaccine.
Good morning. My name is Russ Neal. I'm here because of the community.
I'm Donna Skoda. I'm the Health Commissioner, and I'm here to provide any guidance and insight or information I can. Thank you for inviting me.
Hi, Veronica Sims. Thank you for the invitation. I too am here to garner any additional insights and to hear from the community.
Hi, my name is Tracy Person, and I am here to give information as well as receive information.
Good morning. This is Dr. Thomas File. I'm the chair of the Infectious Disease Division at Summa Health, and it's a pleasure to be with you this morning, if only by phone, and I look forward to our discussions.
Thank you, Dr. File. These issues, questions, and concerns came from group meetings, and Keisha's collected this, over the last few weeks, what kind of issues and concerns people at these different meetings were having.
My family, friends, and I are on the fence about getting vaccinated. Are there others here who feel the same way?
I'm just trying to understand more about it and what this is new.
Yeah, I was a little hesitant about taking a shot, but I went on and took both of them. But I don't want to be walking around here ducking and dodging people for the rest of my life, thinking that they got something, and I don't want to hug them, I don't want to touch them. People can't live like that. People need to be loved and hugged and everything like that. So, for the safety of everybody else, I went on and took the shots.
And I would say, just first of all, I want to validate everyone's concern because I don't think any of us here didn't have those concerns. And I think particularly for the Black community, we have a history, so I get that. I actually have had both shots. My daughter is getting her second one at this very moment, and my husband is fully vaccinated. I think coming here and exposing yourself to these opportunities to learn more and to get information is key. I had a little anxiety because I wasn't coming here to tell you yes or no. For me, I think that it's very important, but I think that we all have to come to our own personal decision. And I hope that what we offer today will help influence you in that way. My mom, who's 82, was very reluctant. Her history is deeper than mine. But I'm pleased to report last Sunday, a couple of weeks ago, she called me and she wanted to go. And so last Sunday, I took her and my younger brother, and they got their first dose. I didn't have any side effects. I had a little pinch in the arm. My mom called me, and am I allowed to say, is this personal story? I know we're prohibited. Oh, my mom, as soon as the phone rang and I saw her name, I was all nervous, and I was like, okay, mom, if you're in pain, take some Tylenol and just, I just trying to calm her. And she's like, no, I didn't have no side effects. And so I was pleased about that. But again, I'm not here to say you should do this, but I am encouraging you to find out the information. And if the decision, and I don't want to minimize your concern. There's so much we don't know about, right? I mean, I get a headache, I pop Tylenol. I haven't never read the ingredients or anything like that, and I didn't really give it much thought. I think I trust in some ways the people who created it knew what they were doing, kinda, sorta. And so I didn't get that. But I tell you, when I heard the information about Johnson & Johnson, that was very upsetting to me. And so for me, I'm glad that I did it beforehand, because I don't know if I'd be feeling the same way that I feel right now, if I'm being transparent. But I would encourage you to continue to participate and engage in these kind of discussions and really listen to the folks who have studied long and hard to do this. I mean, they came to this place because they wanted to help, and I think that is the intention, and I think that we should follow the science and the people who know the science. Thanks.
Thank you all so far. If there are no other comments on that first hesitancy, okay, go Donna.
I'm sorry, Tava. I wanted to just comment, just briefly, and I know that I'm very close to the situation, and I know the apprehension and the fear, and I respect that, because it is a new virus. I mean, I'm old enough to remember being a little kid and getting lined up and get polio, okay? And my mother said, "You're taking it," okay, end of story. And I think those were different times because we didn't have the media, and probably there were reactions then, but it wasn't on the front of the paper. And you know, everything now is in real time, and I think it tends to scare. I agree totally with what Veronica has said about get reliable information and make a personal decision. But I can tell you honestly that I had to take my vaccine in order to continue to work vaccine clinics. Our medical director was adamant that you couldn't work the vaccine clinics unless you were vaccinated, simply because of the risk. I have seen, and I've been very close, we've had about 48,000 cases. I've talked to lots of those cases. And I have to tell you that there are side effects far worse of getting COVID-19 than anything that this vaccine will do to us. I have seen 88-year-old people bury their 50-year-old kids. And I've seen a lot of long-term effects in individuals with breathing, with their compromised breathing, or they have a heart arrhythmia, to the fact that now both SUMA and Cleveland Clinic have clinics set up for individuals to go to who have these side effects. So if you can prevent ever getting COVID or getting it to the point where it causes you to have any of these long-term effects, I'll take every advantage there is to try to avoid it, simply because it is such a risk.
These vaccines that are available are extremely safe and remarkably effective in preventing disease. And when you figure that over 500,000 Americans have already died of this, I mean, the fact that we've got vaccines that are going to prevent this and prevent transmission, this is truly remarkable, and we need to take advantage of it. Now, we need to be transparent, however. I say it's very safe, but we do expect that there are going to be side effects, and we need to make sure that all of our recipients are aware of this. Most of these side effects are going to be relatively mild and last for just maybe 1 or 2 days. I mean, we could expect that people are going to have soreness at the arms of the injection site. There can be patients who have low-grade fever. They're going to maybe feel achy. They're going to maybe feel tired and have chills, but it's going to go away. And this is in part because this is a brand new virus, so it's a new form that's being introduced, so our body's immune system is reacting to this. So when I tell patients that, or when patients tell me that they are having these types of reactions, I tell them, well, that's, in a sense, that means that your immune system is working, so that is good. Now, and I have to tell you that, there's been over 200 million doses administered in the United States, and so we have a great knowledge of experience with the side effects. I mean, everybody is aware of what happened with the J&J vaccine. And as you're probably aware, yesterday the Advisory Committee on Immunization Practices from CDC recommended to restart the vaccine. Both CDC and FDA have already done that, or at least gone along with that recommendation. And I think that's appropriate because there are going to be some side effects, but these side effects of the blood clots that were mentioned and caused the temporary pause of the vaccine a week ago Tuesday are extremely rare. And when the CDC evaluated these types of side effects, they were generally in younger women under the age of 50. And let me just say this, that these types of reactions of the blood clots are much more common in patients who have COVID than patients who have been vaccinated. So we can really prevent many of these blood clot type of reactions if indeed we get vaccinated. So I just want to clarify that. There's always going to be potentially side effects with any type of intervention, any type of medicine that people take, but we always have to consider the benefits versus the risks or versus the side effects. And I can tell you from all of the information and all of the 200 million doses that have already been administered, the benefit to prevent this infection is far outweighs the risk effects, because the way we're going to get out of this pandemic is for everybody, or at least as many people as possible, to get vaccinated.
I received my first shot and I'm not willing to get the second shot because of the side effects. Have you heard anyone express these same concerns?
I have heard from a team member that she said that her husband got the first shot, that he was fine the second shot, that he was out for 2 days. So she actually took a couple of days off in preparation of getting her second shot. So, but she said that her father, who was older, didn't have any side effects. So. And she was younger.
Okay, it's my understanding that there was a question about any way we can ameliorate or reduce some of the side effects after the vaccines, and particularly after the second one, which sometimes is more reactogenic or associated with more side effects than the first one, although that's not always the case. I mean, I've definitely talked to patients who have had more side effects the first one and the second one didn't bother them at all. But yeah, there are ways that we can reduce some of these side effects, and that is to take medicines that reduce fever or reduce some of the pain or discomfort. And I'm specifically referring to medicine like acetaminophen, such as Tylenol, or ibuprofen, such as Advil or Motrin, those types of drugs. And that's very acceptable in patients after they've received their vaccine and start to have some of these symptoms, which indeed will ameliorate or reduce some of those symptoms. I would, however, caution our patients not to take it before the vaccine. And I say that because, well, first of all, there's no evidence that taking any of these medicines before the vaccine reduces the side effects afterwards. And secondly, there is indirect evidence that by taking these types of medicines before the vaccine, you may reduce the amount of immune response. Therefore, you wouldn't want to do that to reduce the ability of the vaccine to produce good results and good immunity. So don't take it before, because it might have detrimental effects on the benefit the vaccine. But afterwards, if you develop those symptoms, and let me just say that the symptoms usually occur don't occur until about 8 to 12 hours, sometimes even 24 hours after the vaccine. But as I said earlier, these symptoms that occur, whether that's a low-grade fever or achiness or fatigue or pain at the injection site, of course that can occur somewhat earlier, but they usually only last a short period of time anyway. So taking some of these antipyretic or anti-fever medicines, anti-pain medicines is certainly acceptable. The one caution I would have is that for pregnant women, they should avoid the ibuprofen or Advil type drugs, but it's certainly okay to take Tylenol.
My husband had the Moderna. So he works in a hospital environment. His broader thinking was his mom is nearly 80, our family, and just being in that environment all the time, it meant more to him to try and safeguard us I don't know if some of this is just being anticipatory of having it, because I anticipated I was going to be a little sick too, going to take a day off the next day too, but that didn't happen. So I don't know if sometimes the anxiety of that. We worked the fairground. Of course, she works it all the time. I went to volunteer, and people are hyperventilating because a lot of them, they just don't like needles. I mean, they were just like, nothing. It's like, I'm okay, it's not the shot. I just don't like needles. So I think sometimes people kind of get themselves kind of riled up, and that doesn't kind of help.
I've had COVID already, and I don't see the need to vaccinate now. Do you?
Okay, very good. Well, as I understand it, the question is, if somebody's had COVID, should they get the vaccine? And the answer is definitely yes. I mean, many people have heard that maybe you should wait 90 days, but that was a recommendation when there was a shortage of the vaccine, and the thought was that if you've already had COVID, you are going to have some degree of natural antibody and some degree of protection. So if there was a shortage of the vaccine, let's give it to somebody who doesn't have any protection. However, now there's really no shortage of the vaccine. And what's interesting about this vaccine versus natural infection is that evidence so far suggests that people that receive the vaccine have a much higher degree of immunity than they do with natural infection, and therefore that's going to be associated with likelihood anyway of a much longer duration of protection. So now we do recommend that patients who have already had documented COVID, that after their isolation phase, because we don't want them necessarily to get a vaccine when they're in isolation because they're potentially transmitting at that time. But when they've recovered from their infection and they're out of isolation, go ahead and get the vaccine, because the vaccine will provide a much higher degree of immunity. Therefore, we think a much greater duration of protection. So there's going to be a double benefit there. And so people who get the vaccine, in addition to having the natural infection, it is a benefit, and we recommend that.
I have a question on that. And this is for you, doctor. And the words in which you're saying as far as to, quote unquote, double the immunity, how is the immunity measured?
Oh, well, actually, that's a very good question. And right now, you can measure a degree of immunity by measuring antibodies to the antigen in the vaccine or after the infection. However, what we really don't know is how that degree of level of antibody actually correlates with degree of protection. So we really don't know that right now. Studies are being evaluated. The best way to really know how well and how long the protection is going to last, just to follow these patients longitudinally for a long period of time. And that's what's happening. The patients who are in the clinical trials for all of these vaccines are continuing to be followed to see how well the vaccine works over a period of time. I think eventually we will know as far as measuring antibody levels, as what we can then predict how well a patient will be immune. But right now we don't know that information. It's not recommended that we necessarily, test patients after they've had the vaccine to see, how well or how long they will be immune. So right now it's just based on following patients over a long period of time to make sure that they are protected against infection.
Thank you.
Hello. I've heard that if we get the shot, I may need a booster shot within a year. Is this true? What's the pros and cons?
Hi, this is Donna. I can start with that because we have been given information from the Centers for Disease Control and from the state of Ohio that indicates that perhaps there's thinking, I think both Moderna and Pfizer have come out and said that they are anticipating a booster shot in the fall. And I think you have to think about it is that every year you get a flu shot, and it's because your immunity, starts to wear off at that 6-month point. It's why we're always concerned if individuals get their flu shot too early it's better than not getting one at all, but you figure you get into March, and sometimes in April and May, we see a spike of the regular old flu. So we want individuals to be as protected as you possibly can. So boosting your immunity is always a good idea. And you're gonna have to do it with this sort of virus, particularly as we get these new variants. And I'm sure Dr. File can give you a far more sophisticated answer, but I can tell you that I foresee in the future we will be doing this for years to come. My understanding is also there are a few companies that are developing both flu and COVID in the same vaccine.
I have asthma-related problems, high blood pressure. Should I be concerned about these underlying conditions if I get vaccinated? Are there pre-existing medical conditions that may preclude a person from getting vaccinated?
I'll answer. And I'll answer on the aspect of your other underlying conditions. Just as you have those conditions, you are already in or should already be taking certain precautions in just, taking care of those issues. May it be asthma, making sure you have your inhaler, if whatever is causing or triggering your asthma, if it's allergy, then you're taking an allergy pill or, whatever the case may be. If you're diabetic, then you know that diet is what's going to be very important for you to, stay, healthy and have regulated numbers and so forth. So when we speak of underlying conditions, we as individuals should already be tending to those conditions.
Okay, well, thank you. I mean, the question has to do with somebody who's got asthma and maybe high blood pressure. Does that affect getting the vaccine, or should they get the vaccine? And the answer is definitely they should get the vaccine. It's not going to adversely affect their asthma or hypertension. In fact, those are two conditions for which are really indications to get this vaccine, because if you have those conditions and you develop COVID-19, you can have serious complications. So you certainly want to prevent that. So any of these underlying conditions, whether it's heart disease, lung disease, diabetes, etc. These are all associated with the potential for severe complications that you certainly want to prevent. Now, one of the questions is, are there any pre-existing medical conditions that may preclude a person from getting the vaccine? And really not. I mean, the only thing would be is if you know that you are allergic to any of the components of the vaccine, and most people aren't going to know that, although a person who does have an allergy and have been evaluated by an allergist, they may be aware if they're allergic to this substance called polyethylene glycol. This is a preservative that's in some types of medicines and other substances that people may be aware of if they're allergic. I say that because that is in some of the vaccines, and so you should be aware of that. Otherwise, unless a patient has had a severe, what we call anaphylactic, that's a very serious complication almost immediately after a prior vaccine, then there really is no significant pre-existing condition that precludes a person receiving the COVID-19 vaccine. Now, as you're aware, I mean, with this J&J issue, I think young women may want to discuss with their care provider about getting that vaccine. But even, let me just tell you, even with that J&J vaccine, this blood clot issue is so rare, it's even more rare than a woman associated taking birth control pills. So I just want to make sure you're aware of that. And then there was a question about other vaccines. I mean, should you take a flu vaccine? Should you take a shingles vaccine? And that's a good question. Right now, the CDC guidance is that you should wait 2 weeks, either before or after the COVID vaccine, to receive any other vaccine. And that's really only because we just don't know what the side effects might be or the benefit might be of co-administering with other vaccines. And so the recommendation is wait 2 weeks after receiving the COVID vaccine, or let's say you did receive the shingles vaccine today, well then you probably should wait 2 weeks to receive the COVID vaccine. So I just want to wait 2 weeks between administration of these vaccines. Now, there are going to be some times when that may not be practical, and we've had pregnant women, for example, who are scheduled to get their Tdap vaccine to help prevent whooping cough or pertussis, and that's already been scheduled. And we'll allow it maybe 7-10 days after the vaccine, because we want to make sure that everybody gets protected against everything they need to be protected. Now, talking about pregnant women, this is an extremely important issue. Because you're probably aware that in the clinical trials, pregnancy was excluded. So we really don't have the data from the clinical trials. However, since the vaccine has been administered, there's been tens of thousands of pregnant women who have been immunized. And I'm happy to say that in the data that's being evaluated, there's been no untoward effect or even no increased side effects in pregnant women versus non-pregnant women with the benefit of having received the vaccine. And I think it is important for pregnant women to receive the vaccine. Number one, we know that pregnant women have higher rates of complication with COVID if they were to develop that. And secondly, there is increased incidence of preterm birth, so that it might affect the baby. And thirdly, we know that the babies who are born to women who have received the vaccine, they are protected for a period of time because they receive some of the mother's antibodies. So that can be a helpful protection for the baby. So, and then I guess the other thing I would say about pregnancy is that, the American College of Obstetrics and Gynecology, which is the major professional society of obstetricians, they do say it's okay to receive the vaccine. And so I think it's important to understand that they appreciate the importance of the vaccine in pregnancy as well. And I mentioned earlier that pregnant women have been followed who have received the vaccine. I know that of earlier this month, I think by April 5, there is this sort of observation or surveillance program that evaluates patients who have received the vaccine. In fact, everybody who receives the vaccine, you can sign up for what's called this V-Safe program. This is a program that goes through your smartphone. It's a tool, and the CDC asks you periodically what kind of reactions you would have. I know that by April 5, over 77,000 women who were pregnant who have received the vaccine have been followed with this surveillance system. And again, there's been no untoward effect that we're seeing in the pregnant women that would not be expected, that would not have been expected in pregnant women who have not received the vaccine. So I think that's good information to show the safety of the vaccine in pregnant women.
Yes, I just wanted to answer something that Tracy said, and I want to commend Sister Donna Skoda and the health department. If someone's having problems getting a vaccine, I would say contact myself or Veronica, because we reach out to Donna. I mean, it's the hookup.
I also just wanted to let you know we are campaigning and actually canvassing the Black communities and targeting certain zip codes and letting people know of, not just the community clinics that are being established within the city, but also if they're not able to at a certain time hit those communities, that they can call the phone number that's on these flyers. We are targeting Black businesses and businesses within the Black community for them to hang this up to give this information. This is an initiative by several community partners we're working with Access Point. So there's a phone number on this flyer that is specific to this cause. So if you call the number, you're not gonna get on a lottery or, anything like that. You will get scheduled to get the appointment for vaccination. It is also the Moderna vaccination that is being offered, in this initiative. So we are working in several locations. I know the one site that we have an actual date is with Goodyear, who has partnered with us as well, making sure that we get the community vaccinated.
Thank you to our community leaders and our community for sharing in this platform. And then we'd like to have some final remarks from Dr. File, and then we would like to close.
Okay, well, thank you for inviting me to participate in this. I hope that you found this helpful. And the only thing I will say at the end is that we all have the power to help end this pandemic, and that is to get vaccinated so that we can get to some semblance of normalcy. So thank you very much and have a good rest of the day.
Thank you.
Shay.